Hello and welcome to Progressive Education Society's Modern College of Pharmacy e-lecture in the subject Natural Drug Technology.
Myself, Dr. Bhushan Pimple. In this lecture, we will discuss upon the traditional systems of medicine. We will specifically focus upon the formulation that is Avaleha. Avaleha are semi-solid formulations usually intended for upper respiratory tract disorder or throat infection, etc. As per the definition of Ayurvedic pharmacopoeia, Avaleha is a semi-solid formulation prepared by using drugs with addition of certain sugar, jaggery or sugar candy. And these contents are boiled with either prescribed juices or the decoction of the crude drugs. They are more popularly known as Modak, Guda, Khanda, Rasayana or Leha. Now we will see the method of preparation. The ingredients used are kasaya or other liquids such as juices of certain plants or decoction of certain plants. Then powder, certain crude drug if mentioned in the formula are taken as very fine powder, and pulps of certain drugs or fruits can also be used depending upon the formula. The major ingredient, that is viscosity modifier and sweetener, is jaggery, sugar or sugar candy. Now this is very important as these ingredients increase salivation, and the Avaleha final formulation is semi-solid or sometimes hard, and after when it reacts with or when it dissolves in the saliva is too watery. The presence of jaggery sugar or sugar candy makes the saliva slightly viscous, and such viscous saliva passes slowly through the throat. That means the contact time of the viscous saliva through when passing through the throat is more, as we have seen in the advertises of Vicks or other similar formulations, strepsils and all. Ghee or oil and honey, if it is mentioned what ghee or oil, then it that could be one of the ingredients. Now ghee or oil here acts as a solvent for extracting certain non-polar phytoconstituents of the crude drug. That means this formulation will now incorporate aqueous polar phytoconstituents and non-polar phytoconstituents as also. It is the method how it is prepared. Initially, sugar or jaggery or sugar candy is dissolved in liquid, either the juices or sometimes water alone, and it is stirred and kept overnight. And after that, the some dirt particles or certain foreign particles, what if at all they are present, are taken out by filtration through muslin cloth. The filtered solution is then boiled over moderate fire until a desired consistency is attained. This desired consistency can be checked by dipping two fingers between the or in a cool solution, usually the thumb and index finger, and these are stretched apart. And if at all a thread-like appearance or thready consistency is formed, then the heating or the heating of this jaggery solution is stopped. At such stage, the even one more method to determine the completion or attainment of the viscosity is by adding one or two drops of the viscous solution in cold water. If the solution sinks in cold water without getting immediately dissolved, then the heating gets stopped. Now, at this stage, the drugs which are mentioned as fine powders are added and they are vigorously stirred and continuously stirred. The reason for this is it should get homogeneously or properly dissolved into it. And usually, all the formulation, or that means this formulation, is prepared. Previously, it was prepared in earthen containers wherein ghee or oil was used to smear the bottom of these vessels so that the contents do not stick to the bottom of the container. And now addition of ghee or oil will also enhance the mixing of the fine powders into the viscous solution. Ghee and oil, if it is mentioned, it can also be added when the mixture is hot, because at this stage only the ghee or oil will easily get dissolved into it. And if certain volatile components containing drugs containing volatile ingredients are mentioned, like say suppose clove or cardamom or ginger, in that case it is added when the mixture is lukewarm or cold enough. Now, as we have discussed in the earlier lectures, that Avaleha is homologous to our lozenges or syrups. So here, after completion of the formulation, it can be tested for following characteristics, or it should have following characteristics, like it should neither be hard nor be a thick liquid. A thick, very thick liquid will be very difficult to take out of the bottle or even to take in a spoon or so. And later on, even after storage, the viscosity keeps on increasing. So just immediately after formulation, the solution should not be more thicker. The presence of fungal growth or fermentation is a sign of deterioration. That means here the sugar and jaggery, they are present, but their amount should be in such high quantity that it should prevent the microbial growth. Like presence of these components, glucose or fructose or sugar in higher quantity increases the osmotic pressure of the solution. Thereby, there are very few chances that the microbes may survive upon it. Like we have murabba in our kitchens. Very similarly, if you add more and more amount of sugar, the sugar acts as a preservative. But in this case, if suppose the amount of sugar added is less, in then there are chances that fungal growth may occur. In that case, the formulation is not fit for use. Then color and smell or odor of the formulation, it depends upon the drugs used in the formulation. Usually, wasaka is added, or licorice is added, ginger is added, and honey is added. So these are the common drugs used in the formulation. If the pulp of certain fruit juices or drugs, or sometimes ghee or oil is present, then the formulation will not get a thicker consistency like that of a Vicks lozenge. Instead, it will be very soft, like uh, it is too soft, like Alpenliebe or jelly chocolates. If metals are mentioned in the formulation, the metals cannot be directly added. Instead, those are first converted to metal oxide by formulation of bhasma, which we have seen previously. Then these bhasmas are added into the formulation. Last, preservation or storage. The formulation should be preferably kept in glass container or porcelain jars. Now, why glass container is because through a clear glass container, we can observe the presence of fungus. Second, it can be stored in a metallic container, provided the metal should not react with it. So usually copper or brass containers are preferred. Also, that depends upon the drugs used in the formulation. Generally, these formulations can be stored for 1 year and not more than that, because we see normally our murabba or any sweet formulation, it cannot last longer more than 1 year. So this is how the storage occurs. About the evaluation of Avaleha, the general parameters such as color, odor, taste, and loss and drawing at 110 degrees Celsius, total sugar content, fat content, and pH of a dilute solution. That means the dilution is specified to be of around 10% suspension. That is 1 gram of Avaleha is to be dissolved or suspended in 10% water, and then the pH is to be recorded of the solution. But before recording the pH of the solution, the contents are to be filtered. The filtrate's pH is to be determined. These are the marketed formulations of Avaleha. The Avaleha is very similar to Chyawanprash, and one of the formulation is Vasa Avaleha, specified for throat infections or cough or asthma. Then, besides, there are other formulations like Drakshadi, Amrit Balattak, and Katakari Avaleha. As you can see here, the Avaleha appears to be very semi-solid or thick in nature. These are the references that reference, that is Ayurvedic Pharmacopoeia of India.